Hi there, this is Dr. Evan Osar. Happy New Year, happy 2022. Hope your holidays were great and your year has started off well. Did you know, if you work with older adults, did you know, are you aware of, that over 50 million individuals in our country alone, America, have osteoporosis and or low bone density? There's 7.2 million individuals that have hip and or knee replacements related to osteoarthritis, which is the #1 cause of disability in the entire world. And so many of our older clients are experiencing sarcopenia, loss of muscle mass related to decreased activity. Actually being in quarantine and being sedentary in their lives. So we have 3 huge issues impacting our older adult population. So you're like, okay, that's great. Know that. How's that impacting me? Well, when I was with my best friend, my longest time friend over this past week, his father had tripped and fallen, broken his tibia. Now he's in the hospital, still in the hospital, dealing with risk factors, kidney issues, some blood pressure issues as well from the broken leg. When we think about our older adults, we think about their cardiovascular health. We think about training them just for general health, but we forget about simple things, or should say, you and I don't forget about it, but the industry as a whole, the medical industry, seems to forget about the issues that are related to things like falls, low bone density, and how these factors, low mass, muscle mass, and how these things relate to overall health, and how quickly our older clients' health will decline when they've experienced a significant fall or a broken bone or something that you and I as younger individuals, younger at 52 for a few more months, younger individuals just take for granted. We break a bone, we heal, we get on with our lives. But as we get older, as our clients get older, it's not that simple anymore. So it's imperative that you and I, as health and fitness professionals that work with this population, understand this link between broken bones, low bone density, low bone mass, which increases bone mass, muscle mass, and increases likelihood of falls. Increases the likelihood of having other health, metabolic type issues. These simple things that you and I can address effectively, and we work on every single time we work with our clients, these things can impact our clients' lives more than just that little bit of a workout or getting a good sweat. It impacts their quality of lives. It impacts their longevity. As I said, my friend's father, several weeks now, still in the hospital. Both my in-laws fell last year. Neither one could get themselves off the floor. Luckily, my brother-in-law was close and was able to help pick them up off the floor. My friend and colleague, Robert Linkle, his father fell, broke his leg, I believe it was, or his hip, fractured his hip. He was in the hospital for quite a few months and experienced a lot of health issues. So we're all impacted by this issue. Now that's the bad news. So you're like, Dr. Osar, thanks for starting out our year on a bad foot. That is just to bring light how this is impacting all of our lives in some aspect. Now, as I mentioned, you and I are in the best position to help these folks and really get this message out, because so many more individuals need to hear this message and need to understand this message. So today, I'm going to share with you one of the simplest, easiest patterns you can do with your clients to improve bone density, muscle mass, and proprioception, which will increase their balance, will increase their ability to stay upright, and give them better coordination so they have a less likelihood of falling. Will it prevent everything? No. However, it will increase, or should say improve, those big 3 things: bone density, muscle mass, and even improve joint health. What pattern is that? It's a split squat pattern. So we know the squat pattern, again, just parallel feet. The split squat, where one leg is in front, one leg is behind, is one of the most important patterns, because when we think about walking is progressing, right? One leg in front, one leg behind, and then progressing to the next leg. The great thing about the split squat pattern, more so than even the squat pattern, is it teaches our clients how to start to load up and preferentially recruit, I should say, or put more load on that forward leg, which is when you're walking, you transition your weight onto one leg and then off of it onto the other side. So we need to be able to load onto that forward leg and then progress our mass forward. So the split squat is a nice and functional progression from the squat pattern. One of the things we want to do when we set our clients up, 3 things. Number 1, make sure your client is best aligned, head and neck, their thoracolpelvic cylinder, ribcage and pelvis, over top that front leg. So when you have your client go into a split squat, make sure they're squared up to their forward leg. Make sure their cylinder, that thoracolpelvic cylinder, is aligned to that forward leg. Because what we want to do is, number 2, once we align, also align that lower extremity, the hip, knee, ankle, and foot, we also then want to teach our client how to hinge. During the split squat, very similar to the squat, during a squat, the squat is basically just a hinge. Well, the split squat is also a hinge. We want to hinge and load primarily that forward leg. So again, what we see with a lot of our clients, a lot of that older population, is they like to lean back and put their weight onto their back leg, which causes them to flex more and overload their knee on the backside, and they oftentimes complain about pain on their back knee. That's because they have too much weight on the back leg. Their weight is not centered and over that forward foot. So again, align, get the weight over the forward leg, and then hinge. So that way you're eccentrically loading the glute, external hip rotators, and hamstring of that forward leg. Now when you come up, have your client come up as if they're stepping forward. So don't come up here and drive their pelvis forward, which a lot of our industry teaches, because again, that's just putting their weight back, moving their center of mass back. It's also over gripping their glutes, which for our older clients that have hip replacements, clients that have osteoarthritis of the hip and or knee, and clients that have spinal stenosis, that's already a problem for them. So we want to teach them how to eccentrically load, hinge, and then come up as if they're progressing forward. So they're still hip extending, they're just not over hip extension, going through overextension of that hip complex. So again, align, stack, align the front leg, hinge, then drive up. Great progression for your client is build up it could be the first level, but also build something up so that way they can work on stepping and dropping their knee towards a target. Now that is reliant upon they have enough hip mobility in this front leg. So again, if your client doesn't have a lot of hip mobility, just build it up. So that way they can hit their back knee and then come up. So the range is less important than giving them a target. Okay, so that's the first progression. The second progression is to start to load it up. So again, you can take some simple dumbbells. Generally, we'll load our clients here, up here at their shoulders, because we want their mass up over top their spine. Because remember, if your client has osteoporosis, you want to load their spine as much as possible in the right alignment. So load their spine. So again, here we go with our split squat position, and it's the same exact pattern, and then coming up. So still loading that front hip and moving forward as if you're going to step forward. If your clients don't do well with their shoulders, then hold the weights down here. The challenge with a lot of our clients with holding the weights here is they allow their shoulders to drop, and that just sort of brings them down into this flexed spine position. So again, load up here if you can. Even a single dumbbell is even better for some of your clients because again, they can stay nice and aligned, they can load, and stay nice and controlled through that position. Now it really helps them a lot load the spine in a good position, even the shoulders in a good position. Now the next progression, if your clients can do it, is an elevated rear leg split squat. So again, an elevated rear leg split squat is just put your leg up on a surface and then it becomes the exact same split squat. But your client needs a lot of balance or a good amount of balance and control to make that an effective pattern. So another option for you is the reverse lunge. Reverse lunge, when you think about it, it's really just a split squat with a step. So again, it's the same idea. Align the cylinder, align that extremity, take a step back. And again, if you look right here, it's the exact same thing we just did. It's just a step, load, you're hinging, loading that front hip, that front leg, and then coming back up. Eccentrically load, really work on that eccentric component, because that's another important component to increasing muscle mass, is that eccentric phase of the exercise pattern, and then coming back up. They're not landing down like that, they're just controlling down. It just gives them a target and then driving back up. And obviously you can load this pattern up as well. Again, we like to load at the shoulders, as I mentioned. Step a little further than that, control, eccentrically load, and then drive up. Control eccentrically, drive back up. So easy way to load that pattern up. Again, you can keep it down here as well. Now the last component just to think about with your split squat, your reverse lunge, or your elevated rear leg split squat is looking at the pelvis from behind. Here's what happens for a lot of our clients, is when you watch it from behind, you see the line on my shorts. When clients go down into their split squat, they often run out of range of motion. So that causes them to kick their hip out to the side. So here's what it looks like. They come down, they lose range of motion, then they're out to the side. Or they'll compensate, their hips will stay level, but their knee will give in. So it's basically the same compensation, very similar compensation, same cause. Either their knee goes into valgus position, or they kick their hip out to the side. Same cause, just different reaction. So again, make sure you've done the appropriate soft tissue release. Make sure you've taught your client how to align their lower extremity. Make sure you're keeping the pelvis purely square to that forward leg so they get the appropriate eccentric loading of that forward hip. And that's really how you'll see huge changes in muscle mass in a short period of time. You'll see huge changes. Your clients will report to you, hey, you know what? I just feel more stable on the hip. My hip doesn't give out as much. My hip feels more controlled. I don't have that chronic discomfort in the lateral hip. When you teach your client the right progression, you progress them appropriately, you load them appropriately, and you give them the right progression so that they safely and successfully move towards accomplishing their goals. Increase muscle mass, increase bone density, as well as increase joint health, which relates to fall prevention. These things can not take away all the risks, but address the three biggest causes for why your clients fall. So I hope you enjoyed that video. I hope it made sense. I hope it gave you some things to think about and help your clients progress, so that way you can help more of your clients this year. Because again, we need more individuals just like you out there and reaching more folks, not just in your community, but the great thing about being online now is you can reach so many more individuals across your community as well as across the world with this information. And you and I, can make a huge difference in the quality of lives of our clients as well as our community. Because I truly believe that we can change the world by helping clients regain confidence and competence and understanding the power of your own body, the power of positive mindset, positive movement, positive nutrition. So thank you for allowing me to share this. If you're looking for more information, my buddy Robert Linkle and I, my bald brother out there in California, we're getting together in less than 2 weeks. Less than 2 weeks. We've got Arthritis Training Solution 3.0. So it's the third time we've offered this. Brand new course. Yes, there'll be some carryover, but this is a brand new course where we're focusing more on longevity and sustainability in our older population. Because again, when you think about all the goals your client wants to accomplish, what's probably the number one goal? They want to remain alive longer and they want to remain independent. That's what we're really training our clients for. Yes, they want to play with their grandchildren. Yes, they want to go on vacation. Yes, they just want to feel better. The number one goal is they want to live longer, and most of them want to be independent, be able to live that independent life to the best of their extent and really live a good quality of life. That's what we're training our clients for. That's what we're covering this year in Arthritis Training 3.0. We're going to give you strategies for assessing your client, using corrective exercise, and using the best functional exercise progressions to improve the three big things: posture, balance, and walking. 3 key things that our clients need, that are interrelated, that will help your clients develop a better quality of life. So, if you want more information, the link is in this video. Mary will put this link. Hi Mary, how are you? Thanks for being on. Check out Arthritis Training Solution 3.0. It's a 2-day online, live, virtual, and if you can't be on live, we will send you the recordings. It's over 12 hours of information. You're gonna have a little bit of pre-homework. We're gonna pre-record a section talking about some of the research around posture, balance, and what the research says is the best way to train muscle mass and bone density. So we wanna make sure that this is also evidence-based, so that we're giving you the best and most appropriate information to help you make 2022 your best year, and most importantly, impact the lives of your current clients and attract more individuals that need, want, and will pay you for your expertise. So check out trainingtheolderadult.com. The link is in the video. Mary will put the link next to the video wherever you're watching this. We look forward to seeing you. If you enroll before this Sunday, it's only $209. $209 for 2 days of continuing education from ACE and NSCA. You'll get the recordings, you'll get our templates, you'll get the pre-recordings as well, the homework that you'll watch before you come to the live course. And then in the live course, the 2 days next weekend, Saturday and Sunday, we're gonna go through this, we're gonna just workshop it all. So you're gonna be doing it, learn by doing with us, so that way you really ingrain this information into your own body, so that way you can confidently teach this information to your clients. And like I said, we want to make sure that this information is practical and appropriate. It's the same information we use on our own clients and that we teach in our own certification. In fact, this is the information that I'm going to share with the integrative movement specialists that are coming in this week, and also that we're doing online in our certification program. So we're giving you the best information that we have for training the older adult. So thank you for what you do. Thank you for all you do for your community. Thanks for being that leader for your community, stepping up, bringing your clients together, being that unifying force for our community, for the world. If we can support you this year, please reach out and let us know. If you like this information, feel free to like it and share it with your like-minded colleagues. This is Dr. Evan Osar. Thanks so much for watching. Thanks for all you do. I look forward to working with you and being part of your community this year. Make it a great day. We'll see you soon.